Hi everyone, Dr. Emmy from Pain Free and Fit. Today, a great exercise for those of you with low back disc pain, herniated discs, bulging discs, and degenerative discs after you've been sitting for a while. We're going to discuss the one-legged scorpion exercise and how it can help to activate your multifidus and glute muscles, which typically weaken after prolonged slump sitting. And it also helps to redistribute the inner disc fluid, the nucleus, back to the center, thus relieving that painful pressure on the back of the disc. Hope you enjoy. So if you suffer with low back disc herniation, bulging, or degenerative disc disease, you've probably figured out by now that prolonged sitting, especially in a slumped position, often aggravates low back pain. There are several reasons for this. The first is that when we sit, we many times compress the disc 12 to 13 times versus when we stand. Sitting slumped moves the inner disc fluid, known as the nucleus, backwards into painful fibers on the periphery of the disc, causing pain. The multifidus muscles are small muscles that help stabilize the lower back. When we sit prolonged, especially slumped, it has been shown that these muscles become inhibited, meaning they weaken, they shut off their activity, and they can't stabilize the spine, thus making excessive movements in the spine more possible that can injure the disc. Thirdly, when we sit and the leg is bent up, the hip flexor muscles on the front of our body tighten. When the hip flexor muscles tighten from prolonged sitting, it reflexively weakens the glute max or main buttock muscle. When you have a weak buttock muscle, mechanically, your buttock can't participate in walking and lifting and squatting as much as it should, and low back muscles then have to overwork, thus stressing your low back. So we're going to introduce an exercise today that actually undoes all of these effects in one movement, known as the one-legged scorpion. It's a simple exercise to do after you've been sitting for a long period of time, but you could also use it throughout the day to help strengthen the multifidus muscles, glute muscles, stretch the tight hip flexors, and more importantly, because you'll see as the leg goes backwards during the exercise, it increases the arch or lordosis in the lower back, thus compressing slightly the back of the disc and helping to move the disc nucleus, which is that inner fluid, back to the center of the disc where it belongs. That relieves the pressure on the back of the disc wall and helps to relieve pain. So here we go. We simply choose something we can hold on to that's slightly forward. We can brace. It could be a couch, it could be top of a chair, and you're going to set the body so that you have a slight incline from your ankles all the way up through your shoulders. From this position, I'm going to slowly raise one leg backwards, allowing the knee to bend, trying to squeeze the buttock muscle and making sure that I'm not trying to overarch the lower back. The lower back will increase its arch, but if you go too far and feel pain, you're raising the leg that high. You have to shorten the range of motion. And I'll alternate from side to side. And if you notice, my leg is going not straight back, but back and to the side. That helps to activate the side of the hip muscles, known as the glute medius as well, and also offers a little bit of lateral compression on the disc. And I simply alternate going back and forth, holding for a few seconds in the up position. And as my leg's back, what's happening is that the arch in my back is increasing. And as it increases, it's squeezing that nuclear material in the disc back to a more central position. Because I'm focusing on holding the leg in that position, it's helping to activate my multifidus and glute muscles and simultaneously stretch the hip flexors. And I'll go back and forth and perform a set of 10 to 20 repetitions. When I come up, see how your lower back feels. Oftentimes it's going to feel much better. You could use this 2 or 3 sets after you've been sitting for a period of time. You could also use this as a strengthening exercise, which then would not be done every day, but you could use it as a strengthening exercise to increase the endurance of your extensor muscles, increasing reps slowly and building up from workout to workout, perhaps 2 or 3 times a week, never on alternate days, to eventually 100, 200, or 300 repetitions. Many disc problems have been shown to have poor extensor endurance strength, which means that the muscles that extend or increase that arch of our back are weak, or they can't continue contracting for long periods of time. They fail, they fatigue. So this is an exercise that if we build up those reps, it'll help long term to correct that extension endurance weakness, causing it to become stronger and support your low back health. If you've liked the one-legged scorpion exercise for degenerative, herniated, and bulging discs, please feel free to subscribe to our channel. Got a lot of other great exercises out there to teach you. Questions or comments, write in. As always, I'll do my best to answer. And remember, if you're looking for a great program to check out your biomechanics, how they relate to your lower back pain, and to step-by-step build your unique tailored exercise rehab program to help your disc pain, check out our Fast Track program for degenerative disc disease. It's applicable to degenerative discs, herniated discs, and bulging discs, available at painfreeandfit.com. I hope the one-legged scorpion exercise helps you with your chronic low back pain after sitting by improving all these mechanical aspects.